Now for the next surgical stuff we are going to talk about as related to women issue, of course. This is the bilateral uterine artery embolization. Okay, so trying to define terminologies from where we are coming from. When you say bilateral, you simply mean the thing is on two sides. This side was embolized, this side was embolized. Now what is embolization? You are basically trying to block. Probably there's too much bleeding from the uterus, so you are trying to block the blood supply, okay, which is mostly commonly the reason. So it's a minimal invasive procedure. It's used in treating conditions like uterine fibroids, or sometimes there's some abnormal growth in the uterus, so you want to starve it of blood, okay, or maybe there's severe uterine bleeding, so you want to do this by blocking the blood flow, okay. That's blood that will actually come to the uterus from the two uterine arteries, okay. So it's performed by interventional radiologist, and offers an alternative to surgical treatments like hysteroscopy. That means it's a small surgery that can save your life and prevent you from having a bigger surgery, okay. So it involves the selective occlusion of both the uterine arteries using embolic agents. So you put it here, you put them, come down here, and you block, okay. So examples of these embolic agents include the polyvinyl alcohol particles or microspheres. This will reduce blood supply to the uterus, particularly usually targets fibroids or if there's abnormal or too much bleedings, okay, from the uterus. You want to block the big blood supplies. So this can now lead to shrinkage of the fibroids. That's when you starve them of blood, or if there's bleeding, you can now cease the blood loss, okay. So indications. Why will you actually want to do a bilateral uterine artery embolization? If you have fibroids and the fibroids are causing a lot of heavy bleedings, pelvic pains, do you understand? It's a symptomatic uterine fibroid. So you can have some fibroids there and they are peaceful, no issue. Postpartum hemorrhage, adenomyosis, failed medical management of abnormal uterine bleeding. So somebody has been bleeding so much, you have been given all those, drugs that will stop bleeding, but it didn't work, okay. So contraindication, you shouldn't block the uterine artery if the person still wants to give birth. Sometimes it might actually cause some damages, long-term effects. If there's active pelvic infection, you don't give it. If there's uterine malignancy, you don't give it. Then for the material you are using for the embolic agent, if the person is allergic to it, you still don't give it. So it's performed under local anesthesia with sedation. Catheter is inserted via the femoral artery or the radial artery. Okay, so they guide it on imaging. Okay, then you put it there. So benefit is to basically solve all those problems that we're listing that you can actually do this for. All right, and prevent the bigger surgeries from coming in.